I am Dr. Sreekanth Appasani, Medical Gastroenterologist, Advanced Therapeutic Endoscopist, KIMS Hospital, Secunderabad. The topic for today's discussion is Hepatitis B. We need to know in detail about Hepatitis B because it's a preventable disease. It's a disease which has got a complete cure with the help of vaccination. So we need to have some basic understanding about the Hepatitis B, the problems it can cause, and the treatment options which are available. Hepatitis B is a virus. It is present throughout the body, but it affects mainly the liver. So it causes damage to the liver. And the damage to the liver caused by Hepatitis B is so slow that you will not recognize it or realize it until it has completely destroyed the liver. So if you ask me what are the symptoms of Hepatitis B, I would say none, because the symptoms might not be there when you have the infection in the initial few days or few years. But once the liver gets damaged, then the symptoms start coming up. It might be simple things like loss of appetite, where you don't have the wish to eat food, or it may be loss of weight, it may be weakness or asthenia, and then slowly comes the complications. What are these complications? These are complications because the liver is getting damaged because of Hepatitis B. Jaundice, liver becoming swollen up, liver function goes down, so you start developing fluid in the feet and the tummy, ascites. The blood clotting capacity comes down, you start bleeding. You might bleed from the intestine, vomiting of blood, which is known as varicose bleed. It might affect the liver completely and it might cause brain abnormalities causing encephalopathy and coma. So these are late stages of liver disease related to Hepatitis B, where we call it as cirrhosis. Initial stages might not have symptoms. It's only the tests which tell us that the liver problem is there. Hepatitis B is a blood-borne disease. It gets transmitted through blood and blood-related products. Prior to 1980s or so, Hepatitis B was not known or detected. So we did not have good testing modalities to know whether a patient has got Hepatitis B or not. And the sterilization methods were not so great at that point of time. So it used to get transmitted through shared needles, surgical instruments sometimes not being properly sterilized, blood being donated and given, but it is not screened because it was not available and all. So even till date, if places are still using these practices, then shared needles, unsterilized surgical equipment, and blood transfusions can cause Hepatitis B transmission. However, right now we use disposable syringes. We have fully good equipped sterilized operation theaters, so the chance is very less. All blood banks have very good inherent testing modalities. Now, if you take blood from quacks and from other unauthorized centers, yes, there is a chance that Hepatitis B can get transmitted. But if you are taking from authorized blood banks, where Hepatitis B testing is done rigorously and intensively, probably the chances are less than 0%. Now, apart from this, sexual transmission is the other way in which Hepatitis B can get transmitted from the one partner to the other. So, it is mandatory that the spouses get tested and then take appropriate preventive measures to prevent this modality of transmission. Now, blood and blood product transmission simply does not mean only surgical equipments and shared needles. We have other things also which can transfer blood products. Example, toothbrush, tongue cleaner, nail cutters, and shaving blades. As such, they might not contain blood, but once in a while they might be contacting with blood. So these are also the equipments where blood can transmit Hepatitis B through these modalities, like sharing a tongue cleaner, sharing some shaving blades, then sharing the toothbrushes, sharing nail cutters, etc. So a person who has got Hepatitis B in the family probably should separate these particular equipments and probably should not use them along with the others to prevent the transmission. There are some myths that Hepatitis B can get transmitted through touch, so it is an untouchable disease and all. No. You can live in the same house, you can eat in the same plate, use the same clothes, same towels, same napkins, nothing is going to happen. It is not transmitted by touch. It is transmitted only by blood and blood related products. Hepatitis B is diagnosed through blood tests. HbA1c is the standard test where we can diagnose hepatitis B. The simple test is a card test. We just put a drop of blood and check for it. It's an instant test. Sometimes there may be false positives and negatives. So HbA1c estimation by chemiluminescence assay blood test CLIA is one of the best modalities, or you can do HbA1c estimation through ELISA, which is one of the standard modalities. So these are the ways in which we diagnose hepatitis B by estimating hepatitis B surface antigen. This test itself is not enough. We need to know which stage of disease it is. So we need to do additional tests like HBe antigen, anti-HBe, which says whether the virus is replicating, that is dividing or not. Viral load in the body, we need to know to see whether the virus is high or low, and liver function tests, then test to see whether liver damage is happening or not, like INR, which is the blood clotting capacity, ultrasound to see whether the liver size and the function is good or not, and few other blood investigation to see whether the other effects, late effects of liver are coming on the, late effects of hepatitis B are coming on the body or not, like creatinine, then blood counts, then platelets, etc. Yeah, hepatitis B virus infection is not the same as other viruses, other infections. In the other infections, if you have the problem, you go and take treatment. Whereas in hepatitis B, it is not like that. Hepatitis B patients are of two categories. One category is the active category. We call it as active hepatitis, where the virus is very high, the viral load is very high, a lot of virus in the body, body's immunity is low, and the liver gets damaged. Since the liver is getting damaged, this particular damage in the first few months or years will be known only through blood tests. If you do not recognize it or do not get tested, then it can completely damage the liver, causing cirrhosis, like the alcoholics. So alcoholics have a liver damage. So similar to that, the liver can get damaged in hepatitis B, causing cirrhosis and can cause a life risk. But if you diagnose these patients early, when the early stages of damage is happening, and start treatment, then you can prevent this cirrhosis from completely happening. So this group of patients are known as active hepatitis. Now, what is the other group? The other group also has virus in the body, but not high load. Suppose this category has got so much of viral load, that viral load will be very less in the other group. So we call that other group as inactive. This is called as active, that is called as inactive stage, or we call it as carrier stage. In our technical terms, we call it as low antigenic replicator stage. So this stage, virus is there in the body, but the viral load is very low and the body's immunity is very good. So it prevents this virus from causing any damage. So even though this virus is there in this stage, we don't take treatment because that is not damaging the liver. We need to understand that whether you take treatment or you do not take treatment, this virus is going to be there throughout your life. The HbA1c is going to be positive throughout the life in both the stages, active and chronic stages. Inactive, that is inactive stage and active stage also, the virus is going to stay in the body even though we take treatment. So these patients will stay positive. Nothing to worry, we just need to know which stage you are and take the treatment if necessary. 1 in 1 million persons of hepatitis B can become automatically negative without any treatment, but that's a rare chance. By and large, the virus persists in the body for a long time. As I have told you, we need to know which stage of liver disease of hepatitis B we are. If you are in the inactive or the carrier stage, we don't need any treatment. You just need to follow up once in 6 months to 1 year with liver function tests, viral load, and an ultrasound of the abdomen. The other important category, that is the active stage, definitely needs medicines, antivirals. We have 2 to 3 good antivirals which can control the viral load and make them negative within 3 to 6 months of time. In active hepatitis, we take treatment for at least a couple of years. Sometimes the treatment is for lifelong. It depends upon whether the patient is improving or not with the treatment. Now, apart from this, the most important thing is follow-up. Once you start taking treatment, it just doesn't mean that you can go away from the doctor and just continue to take the same medicine throughout the life. No. every 6 months, or sometimes initial first few years we do it every 3 months, and after that we do it once in 6 months to 1 year. You need to get your viral load checked, you need to get your liver functions checked once in a while, and ultrasound, and actually have a monitoring for liver cancers also, because hepatitis B can cause liver cancers in future. So we need to be under constant follow-up with the gastroenterologist, at least a minimum of yearly once. You need to meet them with some information and some tests, so that we can have a check on this hepatitis B. It doesn't matter whether you are in carrier stage or active stage, both the stages patients need to be under constant follow-up with the doctor with some investigations. Now, this is the most important thing. Hepatitis B has got a beautiful vaccine. So we have got one vaccine which is taken in 3 doses generally. For the spouses we give 4 doses, so that the antibody titers rise and you can be completely protected against hepatitis B. In fact, medical professionals like us who are working in hospital environment, we get our antibody titers checked once in 3 to 5 years, and we take booster doses. So hepatitis B vaccination is the best way to prevent hepatitis B. The present generation kids are all vaccinated at birth, so we need not worry about them. The problem is with people who are born before 2000, because we were not vaccinated at birth, because vaccine was not available. So I would recommend all of us to get our hepatitis B checked and take a simple 3-shot vaccinations, that is 3 doses of vaccination, so that hepatitis B can be completely knocked off at the stage. And the cost of the vaccine is very cheap. It hardly costs around 100 to 200 rupees, and it is a painless injection which is taken in the arm. So I don't think so it is a big deal to take this hepatitis B vaccination. The other important thing which I would like to reiterate is the family care. We shouldn't be abandoning the patient just because they are hepatitis B. They can happily stay along with us. Only take a few precautions. The first thing, first check all the family members, vaccinate them. Once they are vaccinated, even if this patient is infectious, they cannot transmit the hepatitis B to the other person because they are all vaccinated. So checking all the family members and vaccinating them is the first thing which we have to do once we find a patient who is hepatitis B. Anybody who is staying in close proximity to them, if they are vaccinated, then there is no chance that the virus can get into their body. The second thing is a few articles like toothbrush, tongue cleaners, nail cutters, shaving blades. These are the only things which need to be kept separately from that person. So staying in the same house, staying in the same room, sharing bed sheets or napkins or clothes does not transmit hepatitis B. So these type of care need not be taken. The third thing is, patient who has got hepatitis B should be very careful of taking anything which can cause damage to the liver, especially alcohol. Already there is one factor which can cause more damage to the liver, that is hepatitis B. Especially, nobody should take alcohol, but if these people take alcohol, they are at a much higher risk of developing liver disease than the normal person. So avoid liver toxic products, especially the alcohol.